Hello? Hello, I'm a first aid. Can I help you? And I'm not tapping very hard on the shoulder because I know I'm going to hurt this poor lady. And it's not like I want to hurt her. So ladies and gents, hazards, hello? Help, I need to get help. What numbers do I use?
112.
112 or another number?
10177.
10177, and I tell them I've got this unconscious lady over here who I don't know why she's unconscious on the floor. Please get hold of them and please let me know as soon as the ambulance is on its way.
Okay.
And ladies and gents, mechanism of injury, that history part, what do I know at this point? Not very much, ne? So I'm not quite sure what's wrong. Ladies and gents, when it's primary survey, what do I want to check again? Where would I check a pulse for this lady?
The neck.
Because she's unconscious, I'm going to go for the carotid pulse. Are you alive? Yes, she's got a nice strong pulse. What else do I want to check?
Bleeding.
Breathing.
Breathing.
I see no blood, obvious blood, because look, I don't have gloves, ne? Because you didn't tell me to make myself safe. No glove, no love, eh? No, don't move too much, don't move too much. But ladies and gents, I am going to go down, look, listen, and feel for breathing, and yes, she's breathing. And ladies and gents, what were you doing? It means the airway was open, eh? Yeah. Ladies and gents, it means actually that sometimes we have to look inside the mouth if there's any food, blood, or vomit, ne? Because ladies and gents, if there is, we have to take it out. But now, let's say there's no concern like that. No object, no problem. She is breathing. She has got a pulse. But I have to now go and get a first aid box or something like that. That's the moment when I will have to place her into the recovery position. And ladies and gents, recovery position is as easy as 1, 2, 3. 3 steps. Ladies and gents, it wouldn't make sense bringing her towards the wall because look, there's no space here. So it will be better to take her that way. So ladies and gents, I need to make her body comfortable to make her to go into that direction. And step number 1 tells me this far, arm that's so far away, I better get it out of the way. And ladies and gents, what I'm going to do is I'm going to gently take this arm and I'm going to move it straight up. Now remember, she's not very unconscious, so it's going to hurt if I push it too straight. So I'm just letting it relax all the way to the top. Step number 2, I'm going to use both of my hands. I'm going to now lift up this knee, bending the leg, putting the foot on the floor, putting my hand on top of the knee. And believe it or not, this knee is the one that's going to make the entire body go over to the side. Doesn't matter how big the person is. Can be the smallest person with me. If you put your hands on top of the knee like this and you roll my knee to the floor, I will go over to my side. Trust me, it's like magic.
Okay.
Ladies and gents, number 3 says this arm that's closest to me, I need to bring it up, over, supporting on the, or resting on the shoulder, supporting the neck, side of the face, whatever is comfortable. And I'm just holding it so it doesn't fall flat. And look at what's going to happen. I'm not even going to use much pressure. I'm just going to roll this knee to the floor and the entire body goes, whether you like it or not. But ladies and gents, she's not 100% comfortable yet. I need to roll her over. I need to make sure that the shoulder, elbow is in a nice angle over here. In actual fact, that elbow needs to prevent her from falling down. This knee has to prevent her from falling flat. And ladies and gents, I don't let this leg rest on the leg at the bottom. That could cut blood flow. And ladies and gents, what you will see is happening is that with the arm that's straight, the head is resting nicely on it. So it's actually keeping the back, the neck, and the head in a straight line. And the other benefit is that you can actually check for breathing. You can check for pulse in this position. And should she vomit, everything will come out. Can the tongue block the airway in this position? Impossible. So if I have to fetch the first aid box, now it would be safe.